Hello, welcome and congratulations. I'm Janet Peterson, Nursing Skills Lab Coordinator at East Liverpool campus. This video is meant to assist you to understand the health requirements of the ADN program. You should have received a health packet that looks like this. If you plan on making a doctor's appointment and handing them this packet, paying and thinking, that's it, I'm done, this video is for you. If you think you have great health documentation in your own files, this video is for you. If you're anywhere in between those two, this video is for you. As you might suspect, doctors' offices are not always as detailed or as efficient as we expect, and let's face it, time is money. You, the consumer, need to be on your toes if you want to get this done right, avoiding extra trips, more money, and hassle. So get your pencils and sticky notes and let's begin. First, note the date on the front cover. Plan on making a doctor's appointment at least a month before that. Now let's tackle this page by page. Page 2. The top right corner is asking for a passport type photo. Here are some examples of bad photos. A passport photo is a shoulders and up photo. It should not be a family photo cropped with someone else's shoulder in the picture. It should be about 2 by 2 inches in size, taken less than 6 months ago. It should be a color, full-face photo with a plain background. Here are some examples of a good photo. Next, the info area. If you do not have your student ID, you can get it from your Flashline account. If you leave this blank on our campus, we can enter it. No problem. Now, we get to the nitty-gritty. If you are pretty familiar with these terms, great. Hang in there. Most people have questions somewhere along the line. I will try to provide common info to avoid multiple calls or emails to the nursing office or from the nursing office. Number 1, tuberculin screening. This is also known as a TB, PPD, or MAN2. Sorry, one name would be easy. You must complete A, B, or C, or D to prove a negative screening. For clarification, a TB test is a skin test done on your forearm. You usually remember it because it hurts, and you need to go back to have it read in 2 or 3 days. Anyway, if you never had a TB test or you don't have annual documentation, you will have to have it done twice. That's part A. That is termed a 2-step. Actually, it takes 4 trips to be completed. First trip, pinch to your arm. Second trip, 2 to 3 days later, which is 48 to 72 hours. No bump at the spot is a negative reading. Negative is good for a PPD MAN2. Third trip is usually a week later than the first trip for another pinch to your arm. Fourth trip, 2 to 3 days after the third trip. No bump, good. If you mess up the timing between the testing, the second test can be administered up to 3 weeks later. If it's more than 3 weeks, then you have to start the 2-step all over. Boo-hoo. Now B. If you can provide 2 consecutive years of negative documentation of TB testing, one must be the current year, then okay, you're done for now. Or C. If you ever tested positive with a bump, then a yearly X-ray is needed. You never need to get the arm test done again. It will always be positive. Fourth, TB titer. Blood work can be done called a TB titer. If you get this done, we need a lab report. not any other kind of documentation. Again, a negative is good, hence one trip, but the cost factor may be a lot different. Everyone needs the TB, Mantoux, PPD, again 3 terms, 1 test, done yearly. Have someone who's good at keeping track of things remind you. And keep your own records. You will need them for employment. Now for the hepatitis information. 3 ways. The last page of this documentation has information on hepatitis as well. A. First way, the series of 3 injections. You may have already done the series of 3 injections. If so, just have them documented. If starting the series, the first injection is with your healthcare provider or health department visit. Second is a month later. Third is 6 months from the first. You will need to turn in your paperwork after the first or second injection and follow up with documenting the third one later. Again, you will be busy with nursing school. Have someone remind you about the one that is 6 months after the first one. Or you can have a hepatitis B titer drawn. If this is your choice, the laboratory report needs to be attached. Hopefully you are immune. If you're not immune, you can have the series of 3 injections, as we mentioned above, or you can choose C. You can choose to do the hepatitis vaccine waiver. This needs to be completely filled out. A witness's signature and date are needed. Next is the Tdap booster. You may have gotten the Tdap vaccine at age 11 or 12 for protection against tetanus, diphtheria, and pertussis, also known as whooping cough. This protection wears off. You may have gotten a TD, tetanus diphtheria, injection previously. Tdap is especially important for healthcare professionals and anyone having close contact with infants. Some people should not get this vaccine. This includes those with an allergic reaction to it, those with epilepsy or another nervous system problem, those with Guillain-Barré syndrome, or if you aren't feeling well on the day the shot is scheduled. If you cannot take the Tdap, the medical reason has to be documented. Annual flu vaccination. This ADN program expects all students to get the flu vaccination. If you're starting in the summer, perhaps you are an LPN or a paramedic. You can provide documentation that you had the vaccine the previous flu season and then document the newer one by October 15th. If you're starting in fall, the flu vaccination needs documented no later than October 15th. If you have a hives-only egg allergy, you can get the inactivated injection. There is also a newer recombinant influenza vaccine called Flublok that contains no egg protein whatsoever. Those not receiving the flu injection need to have a healthcare provider excuse stating the significant medical condition and the rationale. An egg allergy is not an acceptable excuse. Number 5. For measles, rubeola, mumps, and rubella, also known as German measles, we require a titer. The lab reports need to be attached. If you're not immune to all of these, you will need certain boosters. If you have records of your MMR vaccinations, please have the health care provider document these. For a negative or equivocal titer for measles, mumps, or rubella, you do not need the measles, mumps, rubella vaccine, the MMR vaccine, if you already had 2 doses of MMR or 1 dose of MMR plus a second dose of measles vaccine. Again, documentation. If you had no prior documentation of MMR vaccination, you will need 2 doses of MMR 4 weeks apart. Number 6, varicella zoster. This titer needs to be drawn and lab documents must be attached. If results are negative or equivocal, you can provide history of chickenpox or herpes zoster shingles from a healthcare provider, or have 2 doses of Varivax, spelled V-A-R-I-V-A-X. That's the varicella vaccine. These must be given 4 weeks apart. They are very expensive and only certain pharmacies will order them. They are not routinely stocked because of their expensive nature. Number 7, physical examination. Men should be checked for color blindness. All students should ask their healthcare provider to review the list of essential functions on the next to the last page of this document. Please be sure that the healthcare provider's name and title is printed and the office location is filled in. Drug testing. This can be a sticky one. Several students have asked their healthcare providers for a 10-panel drug screen. Make sure they look at the list on your paper. Unfortunately, providers have tested the wrong 10, or only 8, or 9, and not 10 of them. Then the student has to pay the second time for the right 10. Also, do not drink an excessive amount of fluid before the urine test. If the urine test is dilute, test results will be inconclusive and you will need to pay for it again. Number 9, CPR certification. If you already have a CPR certification, check that it is American Heart Association and that it is the healthcare provider card. Certifications are good for 2 years. Local hospitals and rescue squads often offer these courses. No online CPR courses have been sufficient. We do not accept non-American Heart, non-healthcare provider cards. Check with your campus nursing secretary for a local list of those providing classes. If you don't receive a card the day you complete the certification, please have the instructor document that you have successfully completed the course on that date. Turn that documentation into the nursing office. When your CPR card does come in, sign it and bring a copy of the signed card to the nursing office. If this CPR card expires before you graduate, you are the one responsible to complete another course before it expires. Have someone remind you when you need to do this, as you might lose track. You will not be permitted on the clinical site if your CPR certification has expired. Number 10. The Kent ADN program has certain uniforms. These are different from the Kent BSN, Bachelor of Science Nursing uniforms. You will receive information on what is required. Note the 6-week order delivery time frame. Summer LPN transition classes do not have a clinical component. If you choose to have the summer maternity class at East Liverpool campus, it is usually offered shortly after the transition ends. Order early enough to have the uniforms by the beginning of the maternity session. Otherwise, order for the fall term. Photograph. We covered that initially. Now, background checks. First time admits to the program will have a scheduled day for this. We require Ohio and federal background checks. You will be advised regarding payment options. If this day does not suit you or you are in different circumstances, example, you're an LPN, paramedic, returning student, or joining us from another program, then you will need to get this done on your own. Background checks are only good for a year. So if you have one that is older than a year, you need a new one. Locally, the Division of Motor Vehicles can perform this. You will need the results sent to the director of the ADN program. You will need her name and the campus address. Results are usually available in a week or several weeks. If you have not done the background checks with the group, please check with the nursing secretary weekly about the progress on this. You will not be permitted in the clinical area without this background documentation. Since many facilities need this information a month prior to clinical rotations, you may need to get this completed 2 months before you're actually in the clinical settings. In other words, don't delay. Next, release of information. Straightforward, read, print, sign, and date. This allows us to share your medical information. Next page. This is just a check-off sheet to help you keep track of what is still needed. Essential functions. Hepatitis B vaccination information and background checks. In conclusion, tips before you go to your doctor's office or health clinic. Bring all of your health and information records that you have. You may wish to contact your high school for a copy of your immunization records. If you are starting a TB, PPD, MAN2 series, be sure that you can return to that office in 2 or 3 days to get the reading. Reschedule that appointment if you aren't feeling well. You may not be able to get the vaccinations that you need. If you are pregnant or think you're pregnant, many vaccines cannot be given during this period of time. This needs to be documented. Once the initial packet is completed, hooray! You can breathe easy, but only for a while. Remember, everyone needs the TB, MAN2, PP done yearly. Some may need their CPR renewed before graduation. Have someone who is good at keeping track of this remind you. Lastly, keep your own records. You will need them for employment. Thanks for listening.